Right, so today's session will look at the cardiovascular system. So the first part we'll look at is the heart. So cardiovascular system, we're talking about the system of the heart, which is a major organ, which serves as a pump as well. Then we're also looking at blood vessels, talking about veins and arteries. Then also talking about capillary beds. In addition to that, we have the lymphatic system. So lymphatic system is an alternative circulatory system, mainly described under immune system, but it is a system on its own entirely. So our first focus will be on the heart. So this is part one of two parts. The second part, the focus will be on blood vessels. Then we'll do a third part that will focus on blood itself. So firstly, we'll look at the heart, or what we call the cardiac. So this is a conical and hollow muscular organ located within the thoracic cavity. So the heart is found in a small space between the lungs, referred to as the mediastinum. This is a mediastinum. So mediastinum is divided into two major parts. That is superior mediastinum and inferior mediastinum. The point of division of the two is at the level of a horizontal plane cutting through the manubriosternal joint, or what we call the sternal angle of Louis. So this is at the level of between the fourth and fifth thoracic vertebrae at the back. That is posterior. Anteriorly is sternal-manubrial joint. Come in. So we're saying anteriorly is manubriosternal joint. Posteriorly, it's intervertebral disc between fourth and fifth thoracic vertebrae. So superior to that is a superior mediastinum. Inferior to that is the inferior mediastinum. So the inferior mediastinum is further divided into anterior mediastinum, middle mediastinum, and finally posterior mediastinum. So of those three compartments of the inferior mediastinum, the heart is located in the middle mediastinum. Now, anterior to the heart is a ligament connecting the pericardium, this one, what you're seeing here, which is cut there. That is the pericardium. So there's a ligament attached to the pericardium and the sternum. We call it the pericardiosternal ligament. It's the only structure found in the anterior inferior mediastinum. Anterior inferior mediastinum. Then the middle inferior mediastinum, it is the pericardium itself and the heart that is found inside. Then posteriorly, which we call the posterior inferior mediastinum, we are going to find the sympathetic chain. Those are nerves found in the thoracic region. We also find that there's esophagus and aorta in that area. So we focus on the heart here, which is shown. So the lungs here are reflected so that we can see the heart. What is the main function of the heart? So the heart pumps blood to all parts of the body. It's what we call systemic circulation. The heart also pumps blood to the lungs, what we call pulmonary circulation. So this is a major pump of the body with all those four chambers, two minor ones, which is a left and right atrium or atria, then the two larger chambers, which is right and left ventricle. This is the right atrium. The left atrium lies posterior, so it can be seen from this aspect. So let's look at the orientation of the heart. So the heart is said to be a pyramid that has fallen over itself. So pyramid is like a triangle with a base and an apex, which is sharp. So think of it as a pyramid that has fallen to the left. So the apex, which was superior, will lie on the left side, whereas the base, which was inferior, will lie on the posterior aspect. That being said, let's look at it physically. So this is the apex of the pyramid. Then there will be the base of the pyramid. So the apex of the heart points to the left there at the 5th intercostal space. Then the base of the heart is at the back here posteriorly. So this is the base of the heart formed by the left atrium. This is the left atrium. That is the right atrium with the superior vena cava and inferior vena cava entering there. So that is the orientation of the heart. So this position of the heart is influenced during embryology when the heart is forming. So when the heart is forming, the heart develops from what we call the cardiac tubes or heart tubes. They are just blood vessels, more like arteries and veins. Then these two fuse to form the heart. Then from there develop. So there's a process known as cardiac looping when the heart is now turning to occupy its final position. We call it cardiac looping. So occurs around day 18, somewhere there. And then finally finishes around day 21. I may be wrong on those figures. We have to check. So that process called cardiac looping influences the final position of the heart. So during looping, the heart assumes this final position. We'll discuss more about cardiac looping when we look at the embryology of the heart. So the apex of the heart will point to the left like that. Then this is the base. Okay. Clinical wise, the base is here where the great vessels are entering and leaving the heart. Superior vena cava entering, aorta leaving the heart. So clinical, this is the base of the heart. Anatomically, that is the base of the heart, represented by the posterior surface of the left atrium. Aside from that, the heart has borders and surfaces. So 4 borders, 4 surfaces. So let's look at the borders first. So this is the inferior border of the heart, represented by mainly the right ventricle. This is the right ventricle. This is the left ventricle. That is the right atrium. So this lower surface here forms the inferior margin or inferior border of the heart. Then there, where vessels are entering and leaving the heart, we call it the superior border of the heart. Then we have 2 lateral borders. So this is the right border. That will be the left border. That is 4 in total. Inferior, superior, left, right borders. Then we can now look at surfaces. There are also 4 surfaces. So the first surface is here, known as the inferior surface or diaphragmatic surface. The surface upon which the heart is lying on the diaphragm, which is shown here clearly. So all this surface, which is lying on the diaphragm, we call it the inferior surface or the diaphragmatic surface. Then we have this anterior surface now, which we call the sternal surface. This is where the sternum is. This is a surface that lies immediately behind the sternum. So we call it the sternal surface or costal sternal surface, because besides or lateral to the sternum are the costal cartilages. Then these surfaces, where the lungs will be, we call them the pulmonary surfaces. So that is left pulmonary surface, right pulmonary surface, left pulmonary surface. So that is 4 in total. Diaphragmatic, which is inferior, sternal surface, which is anterior, and the 2 lateral surfaces known as pulmonary surfaces, left and right respectively. Okay, so 4 borders, 4 surfaces, apex and base. Those are things we're expecting to find on the surface of the heart. Okay. Other features prominent on the heart are sulcus or grooves. So in total, there are 4 sulcus and grooves. So these are shallow depressions found on the heart. So I'll use the same diagram of the heart to explain these grooves and sulcus. So this is the right ventricle, this is the left ventricle. In between is a septum. Now the septum is located inside the heart to separate the left ventricle from the right ventricle. So externally, the level at which the interventricular septum is represented by the shallow depression here, known as the interventricular sulcus or groove. So this sulcus is seen on the anterior surface of the heart as well as the posterior surface of the heart. Therefore, we are going to have 2 interventricular sulcus. If you look at them, it is just one because it originates anteriorly and then continues posteriorly here. So there, where there are blood vessels and some fatty tissue, adipose tissue there, is a shallow depression. So if you remove the blood vessel and the fatty structures, you see a depression known as anterior interventricular sulcus. Continues all the way posteriorly here, named as posterior interventricular sulcus. So that is 2. The next sulcus is perhaps the deepest one, if I can use that word, is the coronary sulcus. So coronary sulcus encircles the entire heart. So it begins, you can start from anterior or posterior, either way. It is running just inferior to the right atrium, that is anteriorly and posteriorly. Then it also lie inferior to the left atrium here, and then goes lateral and then circles the entire heart. So the importance of the coronary sulcus is that it separates atria above from ventricles inferiorly. So if you hold the heart here at the coronary sulcus, which circles around the heart, superior to it will be the 2 atria, left atria, right atria. Inferior to it will be the right ventricle and left ventricle, which is running through here again. This is atria, this is ventricle, and that is a coronary sulcus there. Okay, so that is the 3rd sulcus or groove we have discussed. The final one is located on the right atrium. It's a vertical sulcus. So this sulcus runs from the point of entry of the inferior vena cava here up to the point of entry of the superior vena cava there. If you can see clearly there is a shallow depression. So we call that as sulcus terminalis. Sulcus terminalis. The word is, there. Sulcus terminalis cordis, or simply sulcus terminalis. Now, the sulcus terminalis is representing a structure at the same plane inside the right atrium known as crista terminalis. Crista terminalis. Spelled like this, crista terminalis. So inside the heart, it is more like a septum, whereas outside it is a sulcus. So sulcus terminalis, inside is crista terminalis. Now, what this does is that it separates the right atrium into 2 compartments. We are going to have the posterior compartment here and anterior compartment there. So the anterior compartment, internally there, it has special muscles known as pectinate muscles. Therefore, it has some roughened texture. It has some roughened texture, like we can see here. That is the anterior surface of the right atrium. It has pectinate muscles, and these muscles make it appear rough. In Latin, they are known as musculi pectinati. Musculi pectinate. Whereas the posterior compartment of the right atrium is smooth, as we can see there, because it lacks these special muscles known as pectinate muscles. So that is one important feature. So this elevation here is known as crista terminalis, represented outside by a depression or sulcus known as sulcus terminalis, which is shown here. So in total, that is 4. Sulcus terminalis on the right atrium, coronary sulcus separating atria above from ventricles below. Then we have anterior interventricular sulcus and posterior interventricular sulcus. So those are the surface features of the heart. Then on the surface of the heart, we're going to see blood vessels as well as arteries and veins. So here you can see those in blue, those are called veins. Those in red are arteries. So we have 2 arteries, 2 major arteries arising from the aorta. This is the aorta and its arc. So before the heart feeds other organs, it feeds itself. So the first branches from the aorta are the coronary arteries, left and right. So what we're seeing there is the right coronary artery, left coronary artery. This will be the right coronary artery. So the left coronary artery emerges from the left aortic sinus. So when we cut open the aorta, we see that the aorta has 3 semilunar valves. So if we are viewing the aorta from this anterior end, we see that anteriorly there will be 2 aortic valves, then posteriorly there will be 1. So in total there are 3. Now, those valves, the area that they cover, we call them sinuses. So in short, there are 3 aortic sinuses with 3 aortic, there are 3 aortic valves with 3 aortic sinuses. So the posterior one is called posterior aortic valve or semilunar valve with its sinus. The 2 ones are called left and right anterior aortic valves, semilunar valves, and their sinuses. So the left and right coronary arteries emerge from the 2 anterior ones. So the left anterior coronary valve, aortic valve with its sinus serves as the origin for the left coronary artery. Then the right coronary artery will emerge from the right anterior aortic valve and sinus. So these are the structures we are seeing here. That is the right coronary artery. This is the left coronary artery. Then gives off so many branches. Okay. Then veins accompanying those branches of the coronary arteries have different names. Like here we have the small cardiac vein accompanying a marginal vein, a marginal artery. As the right coronary artery comes here, it will send a branch known as the marginal artery. Then the anterior, the left coronary artery sends an anterior interventricular artery, which is seen here. What is accompanying the anterior interventricular artery is the great cardiac vein. So there is a great cardiac vein seen in blue. Here is a small cardiac vein. Okay. Then at the back, posterior to the heart here, we see a large vein known as coronary sinus, where most of these arteries will come and merge. The coronary sinus empties into the right atrium, just next or close to the tricuspid valve. Okay, so those are some of the major vessels of the heart. Okay. So here we are just seeing the surface landmark of the heart. So beginning at the second intercostal space, that is second rib, third rib. Second intercostal space, both left and right, then goes all the way to the 6th rib. This is rib 6. But on the left side, on the 4th rib, we see that the heart goes all the way into the 5th intercostal space there. And then at the 6th rib, a horizontal line connects the two. So the heart will be seen here. So injury here, especially penetrating trauma, may cause damage to one or more chambers of the heart. If it's blunt trauma, it may just cause bleeding within the pericardial sac, and that may later on lead to cardiac tamponade and cardiac arrest. So let's look at the pericardium. So pericardium, similar to the pleural membranes that we talked about. Pericardium has two layers. An internal layer known as the visceral pericardium, which is always close to the heart, and it's difficult to separate it from the heart. Then the outer layer known as parietal pericardium, which is very tough, as we can see here. Previously seen in the diagram here, you can see that grayish membrane. It's a very tough tent. So the heart is completely protected from the lungs and their pleural membranes. Okay. So that is a pericardium. So between the two, the visceral pericardium, the one which gives the heart more like a shiny appearance, and the parietal pericardium, there will be a small space known as pericardial cavity. And that cavity is filled with some serous fluid. So of the two, it is a visceral pericardium that produces that fluid. Now, that fluid is maintained under a constant range. Therefore, the amount produced is equal to the amount reabsorbed. So the fluid doesn't increase beyond its normal ranges. If that occurs, mostly when there is infection in the pericardial sac, okay, then we see that there will be increased fluid in the pericardial cavity, what we call pericardial effusion. Or it could be bleeding from either blood vessels in the parietal pericardium, or blood vessels in the visceral pericardium. That blood may collect between the pericardial cavity. What occurs is what we call, if that fluid is not drained, what will follow next is cardiac tamponade, where the heart has less room to expand during contraction. So there is compression of the heart by fluid that is filling here, because look at that. That is a very tough tent around the heart. So a procedure known as pericardiocentesis is done to drain fluid from the pericardial cavity. It has to be done promptly, otherwise patient enters into cardiac tamponade followed by cardiac arrest. Okay. So you now look at the cardiac chambers. So there are 4 chambers. That is the right atrium, left atrium at the back, then right ventricle, left ventricle. So between the left atrium and right atrium, there's a small fossa there. In fetal heart, that is a foramen. There's an opening connecting the right atrium to the left atrium. We call it a foramen ovale. So that is foramen ovale, if it's there and is found in the fetal heart. Now, once a baby is born, that foramen closes. So what remains there is now known as fossa ovale. So what we are seeing there, that depression, is known as fossa ovalis. Okay. If it remains patent, then there will be mixture of deoxygenated blood here with oxygenated blood in the left atrium. And that requires surgical intervention to close that defect. What I want us to observe quickly is the myocardial thickness. So see that the thickness of the myocardium in the atrium and in the ventricles is variable. The ventricles have the thickest myocardium. Look at that, very thin, very thin. Why? Because atria pump blood only a shorter distance from the atria into the ventricle. So you don't need a very thick muscle mass there. But ventricles pump blood to distant organs. For example, the right ventricle will pump blood through the pulmonary trunk into the pulmonary arteries, left and right, going to the lungs. Now, the distance between the heart and lung is short. So that's why this muscle, even though it's thicker than atria, is not as thick as we see in the left ventricle. In the left ventricle, the heart will pump blood through the aorta and then to all parts of the body other than the lungs. So we see that the myocardium of the left ventricle has the thickest muscle mass. That being said, let's look at the layers of the heart. So from inside going out, we have the endocardium. So endocardium is continuous with the inner lining of blood vessels, what we call endothelium. So the structure is the same. The endocardium is made up of endothelial tissue, which is simple squamous epithelium. If you can check here, you see that the cells are flat. So that is simple squamous epithelium, similar to the tunica intima of all blood vessels. We'll discuss more about the layers of blood vessels. Then followed by a thickest layer now. This is a myocardium. So myocardium is muscle, cardiac muscle. I would refer you to tissues where we discussed cardiac muscles. That is under muscle tissue. We discussed the features of cardiac muscles and even their differences from other types of muscles. Then outer to the cardiac muscle is another thin layer now of pericardium. So we see that pericardium, like we earlier discussed, has two layers. The inner layer, which is attached to the myocardium, we call it visceral. Then the outer one, we call it parietal. So the parietal one is made up of fibrous connective tissue, but the visceral one is made up of loose connective tissue, like we can see there. Then space between those two is what we call the pericardial cavity. So these are the four layers of the heart. Endocardium, number one, myocardium, two, then those two layers of pericardium, visceral pericardium and parietal pericardium. Parietal pericardium, visceral pericardium is what is known as epicardium. Okay. So now we can look at the chambers in greater details. Okay. So we're going to look at chambers in greater details. All right, so I'll need to do a separate discussion for that one. So for now, we end it here.